Hi, this is Dr. David Greene, CEO of the Arizona Pain Network, where we connect those in pain with pain providers across the valley. Today the topic of discussion is what is the difference between facet injections and epidural injections? Now, to people who are well versed in pain management, that may be an easy answer to a question, but for most individuals who are facing back pain and or sciatic pain, the answer is not so obvious. So let's start by looking at a little anatomy. This is a spine model. You have each level coming down, and this is the pelvis and the sacrum. Okay? So what you have over here and here and here, these are facet joints. They're about the size of a thumbnail, and there's one at every level on each side of the spine. Okay? They have cartilage just like any other joint, the hip, the knee, the ankle, and they can become arthritic over time. So a facet injection involves the pain doctor placing numbing medicine and steroid in and around these facet joints that are painful. They can work very well. They can last for months at a time. If they work and then wear off, a pain doctor can actually do a radio frequency ablation procedure where it heats up these joints, and that can deaden pain for anywhere from 6 to 18 months. It's very impressive. Okay? Now, what are the symptoms of somebody who has arthritis in those facet joints? Well, it's usually back pain that comes and goes. It waxes and wanes, and sometimes it just waxes and doesn't go away. It bothers somebody every day. It's like a pebble in your shoe, pretty much just nagging away. Okay? So those are the usual symptoms. The pain can radiate into the buttock area, down the legs a little bit, around the side of the back, but by and large it doesn't shoot down the legs. Okay? So that's a facet block. It goes not in the spinal canal, which would be in this space, back this way, but just in these joints. All right? It's a quick injection, takes about 10 minutes per level. Pain doctors do it with fluoroscopy, which is a real-time form of x-ray, and a procedure center, and it's an outpatient type procedure. All right, so let's talk about epidural injections. So the similarities are they're also done typically with steroid medication. They're an outpatient procedure, very low risk. All right, but the needle goes in a different place, and it's for different symptoms. So see these nerve roots that are coming out, these yellow things? All right, and you see this red structure here? It's meant to be part of a disc that has herniated and is pushing on this nerve root. And it can cause pain that shoots down the leg called sciatica. So that's what sciatica comes from, by and large, is when a disc herniates out, and in this case is pushing on, that would be the right L4 nerve root. And usually the pain from that would cause pain down the outside of the thigh, down over the front of the calf, and then on the top of the foot. I mean, if a patient walks right out of a textbook, that's what you would see. Okay? So an epidural injection would be the pain management doctor placing numbing medicine and steroid medication right around the area in this space called the epidural space, and relieving the pain from sciatica. Okay? Sometimes it takes a series of those injections, maybe one every 2 weeks for a series of 3, and that can be repeated every few months. They're very effective, over 75 to 80%, which is another thing they have in common with facet injections. Those are usually about the same sort of effectiveness, 75 to 90% for a period of a few months. The other thing that these injections have in common is that they don't fix anything. Okay? Steroid injections have a huge anti-inflammatory component, which is great for reducing inflammation and taking away pain. A large part of how the pain comes from a disc herniation with sciatica is because this pushing on the nerve root inflames it, and that causes the pain to shoot down the leg. You bathe that nerve root in steroid, it's going to knock down the inflammation and knock down the pain. So that's another thing that they have in common. Neither injection fixes the problem of arthritis or disc herniation. It just brings the pain down. And in the case of a disc herniation, the body can disintegrate this piece because it knows it's not supposed to be here. It just doesn't have a very quick way of taking care of it. Okay, there you have the difference. Check out our website at preferredpaincenter.com. We work with Arizona pain specialists here in the Valley. They are the best pain clinics with board-certified chiropractors and pain management doctors performing a multitude of treatments for everything from headaches, back pain, neck pain, failed back surgery, pelvic pain, abdominal pain. There's a ton of information on our site. I'm Dr. David Greene. Your pain stops here.